Sorry, I had to wait for the preamble. It is my pleasure to introduce the Strasberg brothers, Jim and Marty, although they don't really need an introduction. Between the number of people who know them and the great article, as we can see here, that was in last Sunday's Gazette, most of the people at this forum know them well. They grew up in Troy, the sons of a physician, and have both lived in much of their lives in Niskayuna. Jim tells me that when he was young, he used to make rounds with his dad and gave him an inclination to go towards medicine. Jim has been a practicing rheumatologist for 34 years prior to retirement. He is past chief of medicine at Ellis Hospital and past president of the Schenectady County Medical Society, where he also served as historian for many years. He was associate professor of medicine at Albany Medical College and is a Union College graduate, and he received his MD degree at SUNY Buffalo. He is a member of the Medical Reserve Corps of the Schenectady County Public Health Service, where he continues to serve as a vaccinator at the COVID vaccine clinics. He is active in the Schenectady County Historical Society, having served on their board. The proceeds of this book go back to the Historical Society. He is active in Jewish Federation, having served for many years as a solicitor on Super Sunday. He has been a member at Beth Israel for many years. Martin Strasberg has also been a member of Beth Israel, but recently he and his family have joined our synagogue. Marty is professor emeritus at Union College and Clarkson University, where he taught and published in the fields of healthcare policy and bioethics. He is the former director at Union College and Union graduate MBA programs in healthcare management. For many years, he has chaired the Schenectady County Public Health Advisory Board. He is a Union College alumni and received his PhD at Syracuse University. He recently served on the board of Schenectady County Historical Society. The book is available at the Open Door. You can see it here. And we recommend all buy it and read it. You'll enjoy it. We are honored this morning to listen to the presentation of their book, Schenectady's Battle Against Contagious Disease from Smallpox to COVID-19. I'd like to now turn over the program to Jim and Marty Strasberg.
Thank you, Larry. Am I being seen and heard?
Yes.
Okay. Thank you, Larry, for that really flattering introduction, and thank you for your invitation to speak to Agudas Sachem. About 2 weeks ago, we read in the newspaper, in the Gazette, that Schenectady County had the highest vaccination rate in the state. Schenectady County had the highest vaccination rate in the state. And this shows the public health concerns that both our present city fathers and our historical ancestors had for health, dating way back even to before our book started. Our book started with smallpox in 1799, when yellow fever first came to Schenectady. Within 24 hours, the city fathers had a yellow fever isolation hospital. And this concern with public health continues through the ages. When the smallpox vaccine came available, at the time it was very, very controversial. There was an anti-vax movement back then. My brother will talk about that. But Ellis, not president of Union College, and the medical society, church leaders and city fathers made sure that every person in Schenectady got the vaccine. And this was before there was health insurance, before there was welfare. Everybody got it. In 1832, when the cholera came in, the most devastating of all contagious diseases, within 24 hours, Schenectady passed rulings that everybody had to clean up their filth around their houses from their outhouses. They thought that the disease was miasma, some vapors. That was the wrong theory, but cleaning up the filth was the right treatment. There were 20 physicians in Schenectady in 1832, and everyone was immediately drafted by the city to treat anybody with cholera. A cholera hospital was established, and the physicians were sent to the docks at the Erie Canal to make sure no infected people came in. And this went on and on through the ages, whatever disease it was. Tuberculosis, Marty will talk about that. We were a leader in tuberculosis. We had one of the first tuberculosis clinics in the state. Diphtheria, when Ellis Hospital couldn't take infectious patients with diphtheria, an emergency hospital was opened in the police court of City Hall. And that's where the diphtheria patients were taken. They had an operating room for tracheostomies, and there were police in front for protection. In polio, Schenectady raised the most money for March of Dimes than any other city of its size in New York State. We were one of the only 80 counties out of the 3,000 counties in the United States in 1954 to be a trial for the vaccine. 3,000 of our third graders got injected. So we always had that pleasure. And the one theme that I've read through doing my research is that leadership matters. Leadership who's willing to take a chance. And sometimes you had to take a chance. You know, I mean, they weren't 100% sure the smallpox thing wouldn't clear because it used to. There was some fatalities. And even as far as polio, Walter Winchell went on the air about a week before and said that there were some deaths from polio. No, what weren't deaths? Some infections were found in the vaccine, which was true because they tested all the vaccine to make sure it was pure. And when someone was infected, they threw that away. It showed the system was working. And he encouraged parents to be careful if you have your kids vaccinated. And the medical and said the vaccine is safe. A lot of courage for that. So I think leadership was one of the most important things. The genesis of this book actually started in 2010. The Medical Society had its bicentennial, 200 years. And the Medical Society was started in 1810. Now, why did the Medical Society start in 1810? Because Schenectady County used to be part of Albany County. And it was the same county until 1809. So 1809, it separated as a county, and the following year, the Medical Society broke off. And in honor of our bicentennial, I composed the history of the Medical Society, and this involved going through hundreds, maybe 1,000 minutes dating back to 1810, written in the red-colored iron-based ink, and got minutes, and we published a little book on that, and this was expanded by articles I wrote on the different committee for the Historical Society. And my brother, who was the main author of this book, Marty, did most of the writing based on my previous work, plus additional research, which we was able to do online, even though COVID came. That COVID might have been a big risk to us because we couldn't get into the libraries. But so anyway, that's the introduction. Now I would like to introduce my smarter and younger brother, Marty.
Okay, thank you, Jim. Thank you, Larry. The name of the book is Schenectady's Battle Against Contagious Disease, from Smallpox to COVID-19. You can also get it directly from the Schenectady Historical Society's online bookstore. And as Larry said, all proceeds go to the Schenectady County Historical Society. This book starts with smallpox in the 1600s and has chapters on cholera, typhoid, diphtheria, TB, polio, influenza, and COVID-19 up until August 2020, the so-called first wave of COVID in Schenectady. This is a graph of Schenectady's population. From 1810 to 2000, you see a tremendous rise in population between 1880 and 1930. Schenectady became a boom town, one of the fastest growing cities in the United States. The boom was set off by the arrival of the Edison Machine Works in 1886, better known as General Electric. American Locomotive Company, Alco, was already in town. This 50-year period, 1880 to 1930, is considered the golden age of Schenectady. Schenectady became the city that lights and hauls the world. And this boomtown was accompanied by massive industrialization, urbanization, and immigration. By 1910, 25% of the population of Schenectady was foreign born. However, not all was golden in Schenectady. The rapid growth in population placed incredible demands on the city's infrastructure. Throughout the ages, crowded living conditions, along with poor housing, water, sanitation, poor nutrition, have all been associated with the predominance of contagious diseases. And during this period, contagious diseases were among the top 10 lists of leading killers. And what is remarkable is that in this period, 1880 to 1930, Schenectady made its greatest progress in improving longevity, mostly through the increase in infant and child mortality. Never before and never since has the death rate fallen so much, one of the more remarkable achievements in human history, which was being replicated throughout most of the United States. And this was an era before miracle drugs such as antibiotics. Penicillin didn't come on the scene until after World War II, after 1945. Most modern vaccines didn't come on until much later. That is with the notable exception of smallpox. So what happened in Schenectady? The citizens of Schenectady greatly benefited from the flowering of the public health movement, advanced by great strides in the science of bacteriology and the acceptance of the germ theory of disease. You can consider this the golden age of public health, which overlapped with the golden age of Schenectady, which overlapped with a general rise in the standard of living. And accordingly, pure water, milk, sanitation, personal hygiene became the order of the day. We saw the construction of the Rotterdam Great Flats Aquifer as the source of water for Schenectady. The drinking water supply was pure, greatly reducing typhoid fever and other enteric diseases. So the pasteurization of milk as the standard of milk processing, greatly reducing childhood diseases. The founding of Ellis Hospital, the founding of City Hospital for contagious disease, the founding of Glen Ridge Tuberculosis Sanitarium, the Schenectady Reconstruction Home for Crippled Children, better known as Sunnyview. We saw the establishment of a modern New York State Health Department and a modern municipal Schenectady Municipal Health Department, well equipped with professional staff to carry out diagnosis and isolation and quarantine and other responsibilities, to inspect and regulate water, food, and milk, to vaccinate children against smallpox, to operate the maternal and child health clinics, to monitor the health progress of school children, to educate the public on best practices of disease prevention, to collect vital statistics to understand what's going on in the community. We saw the establishment of voluntary associations organized to raise money for research and treatment and to advocate for better social conditions. What else was going on? The period from the 1890s to the 1920s encompassed what is known as the progressive era that championed social, economic, and political reform. And the progressive era promoted deference to nonpartisan, non-political experts in the sciences, in the engineering field, and social science disciplines. And included in the sciences were sanitary science and bacteriology. And Schenectady was very much influenced by progressive era thinking. And during this period, Schenectady briefly associated with a socialist government. In 1912, Socialist Party member George Lund took office as mayor. And by the way, Mayor Lund appointed Charles Steinmetz to be the chair of the Board of Education. This is a graph constructed by Union College professor Bob Wells, showing the decline in contagious diseases and the rise of non-contagious chronic degenerative diseases in the population. notably heart disease and cancer. So we had a major transition going on. This was between 1900 and 1934. But going back to 1880, tuberculosis was the leading cause of death. The decline in tuberculosis mirrors the decline in other contagious diseases such as typhoid, diphtheria, measles, whooping cough, scarlet fever, influenza and pneumonia, and also diarrheal and other enteric diseases. On a national level, in 1900, cancer accounted for only 3.7% of all deaths. Few people live long enough to die to develop the cancer. Of course, today that has all changed. One more thing has changed. COVID has replaced accidents as the third leading cause of death in the United States behind heart disease and cancer. Now we can illustrate the advancements in public health practices by examining certain contagious diseases. In the interest of time, I'm going to only look at a few of these diseases. I'm going to start off by looking at smallpox in the very, very early history of Schenectady. Smallpox, one of the most deadly diseases known to mankind, was eliminated from the planet in 1979 through the efforts of the World Health Organization. But 100 years before, in approximately 1880 in Schenectady, smallpox had already moved off the top 10 list of causes of death, even though there would be deadly outbreaks continuing for many more decades. Why? The primary answer is vaccination. In contrast to the miracle drugs and modern vaccines that came available after 1930 or after 1945, inoculation came on the scene early, very, very early. And I'll get to this in a moment, but I just want to say that smallpox decimated the Native American population. Dutch fur traders probably transmitted it to the Mohawk villages at least by 1624. Schenectady during colonial times as a gateway to the West on the trade routes, the epicenter of many wars, was a prime target for smallpox, which was spread by droplets from the air or particles on blankets and clothing. One measure that was open to the colonists was quarantine. The practice of quarantine and isolation, which dates back to biblical times, was practiced by the colonists. The word quarantine comes from the Italian word 40. In Venice, during the plague of the late 1300s, the port of Venice required foreign ships to remain in the harbor for 40 days, flying the yellow flag of quarantine. Quarantine restricts the movement of people who were exposed to contagious diseases to see if they become sick. Presumably 40 days would be sufficient. Now, isolation separates out the sick people who already have the disease. The terms quarantine and isolation are often used interchangeably, but even by public health officials, but in reality, they're different concepts. This is a picture of Edward Jenner, an Englishman, who is injecting into this boy material from the sores and scabs of milkmaids who had contracted cowpox, which is much less severe than smallpox, but nevertheless, it conferred immunity against smallpox. Because it comes from a cow, it was called vaccination, from the Latin word for cow, vacca. This was in 1796, but previous to that, there was variolation, which is the inoculation of pus from sores of persons who actually had smallpox into the arms of people seeking immunity. It was much more dangerous than vaccination, but still it was somewhat effective. Variolation inoculation was used in 1721 in Boston to stop an epidemic. George Washington inoculated through variolation his troops during the Revolutionary War. Some of these inoculations were done right here in Schenectady at a hospital in downtown Schenectady. According to medical historian Ira Rutgau, the decision to have the Continental Army inoculated against smallpox is considered one of the greatest strategic and medical decisions ever conceived by a wartime general. Starting in the 1800s, the city hired a city physician to vaccinate free of charge any poor person who needed to be vaccinated. The city also established a pest house for isolation purposes. And over time, there developed a whole routine whereby the city and its Board of Health would track down cases of smallpox, isolate them in the pest house, quarantine those who came in contact with the victim, and then vaccinate as many people as possible. In 1860, New York State passed a law requiring the compulsory vaccination of school children. The compliance, even in Schenectady, was not very high. There was resistance to inoculation right from the very beginning, 1721, which was the start of the anti-vaxxer movement in this country. As we move into our period 1880-1930, smallpox was greatly diminished. And as I mentioned, in 1979, through a worldwide vaccination movement, smallpox was eliminated from the globe. Truly one of the greatest public health achievements in history. Okay. Let's move on to our period 1880, the golden age of Schenectady, 1880 to 1930. We're going to use Dr. Charles Duryea to tell some of the story of public health in Schenectady. Many of you will recognize the Duryea name. Charles was the son of Reverend Isaac Duryea, famous abolitionist, conductor on the Underground Railroad, founder of the first African-American church in Schenectady, the Duryea Memorial AME Zion Church, which is still with us today. Charles Duryea's professional career lasted from 1881 to 1927, which nicely corresponds to our major period of interest, 1880 to 1930. Duryea was a Union College graduate, a graduate of Albany Medical College in 1881. He served as the city public health officer and also as mayor of Schenectady twice. He served as the president of the Schenectady County Medical Society, the president of Ellis Hospital, medical surgical staff. He introduced bacteriological testing for diphtheria, the testing of dairy cows for bovine tuberculosis. He expanded the sewer and water systems. He started a city dispensary for TB diagnosis and treatment, one of the first in New York State. He was the champion of municipal health reform in New York State. He was succeeded by Mayor Lunn in 1912. Lunn continued to carry out many of Duryea's policies. In 1914, Duryea went to work for the New York State Department of Health, which was considered the nation's premier public health department under Commissioner Dr. Herman Biggs, who was a giant in bringing the sciences of bacteriology to medicine and public health. And while he was at the New York State Health Department, Dr. Duryea taught generations of municipal health officers at courses at Albany Medical College. We should also mention that Duryea was one of the founders and also president of the Schenectady County Historical Society. Many people remember Mayor Lunn, few people remember Mayor Duryea. It's fair to say that when Duryea graduated Albany Med in 1881, the great advances in bacteriology and the germ theory were still on the horizon. Most of the scientific advances were being made in European universities. It wasn't until 1882 that German scientist Robert Koch discovered the tuberculosis bacillus and ushered in the germ theory and the age of bacteriology. American medical schools, including Albany Med, were way behind the times. There's little medical research going on in America. Before Robert Koch, instead of the germ theory, the prevailing theory of disease was the miasma theory. The miasma theory holds that odors and gases arising from the ground saturated in human waste and other putrid materials connected with filthy neighborhoods are not only highly associated with disease, but are actually the cause of the disease. So when it came to waterborne diseases like cholera and typhoid, they were thought that they were getting sick from people breathing the gases through their noses rather than drinking the water. No one knew at the time that the contagion was in the water. How could they know? Microbes were too small to be seen. Even a clear glass of water could contain hundreds of millions of bacteria. Nobody knew about bacteria. The miasma theory, prominent especially up until the middle of the 19th century, did, however, produce the environmental sanitation movement that was greatly responsible for the drainage and removal of waste through sewers. In 1882, Professor Katie Staley, a sanitary engineer and professor of civil engineering at Union, noted, and I quote, "The earth upon which the city stands is literally saturated with sewage, reeking in the accumulated filth of 2 centuries, never a day free from disease." The obvious answer: build sewers to remove the miasma producing waste. And Schenectady built sewers. And where did the sewers empty into? The Mohawk River, where it got its drinking water supply. In 1891, not only did Schenectady suffer a typhoid epidemic, but also the cities of Waterville and Albany, which drew their water from the Hudson River, which were the recipients of Schenectady's germs floating down the Mohawk into the Hudson. So all of these cities suffered a typhoid epidemic from the river water. It was a Union College professor by the name of James Stoller, who was a biology professor, who warned Schenectady of the dangers of drawing its drinking water from the Mohawk. His analysis showed that the Mohawk was teeming with harmful bacteria. Fortunately, a great supply of water was found in the Rotterdam artesian wells, the Great Flats Aquifer, which is still our source of drinking water today. To what effect? After the city in 1897 started drinking its water from the artesian wells of Rotterdam, by 1900, Schenectady went from having one of the highest death rates from typhoid to having one of the lowest deaths from typhoid. It wasn't until 1915 that the city opened up its sewage treatment plant down on Anthony Street near the Mohawk, and it is still there today. Before moving on to talk about the Spanish flu, I want to mention an episode during the cholera epidemic of 1832 that nearly changed the course of history. The cholera epidemic of 1832 was perhaps the worst epidemic to hit Schenectady. And in 1832, Mayor John DeGraff asked Union College chemistry professor Charles Averill for help. And Professor Averill recommended that chlorine be added to the drinking water supply. It would have saved lives. It would have been a game changer. Alas, Mayor DeGraff did not take the advice of the Union College professor. The mayor was still operating under the miasma theory. In fact, chlorine was not systematically added to the nation's drinking water supply until 1908, when Jersey City became the first city to systematically add it to use it in its drinking water supply. In the interest of time, I'm going to skip to the Spanish influenza pandemic of 1918-19. This is a chart of US life expectancy from 1880 to 2019. You'll notice the dramatic drop in life expectancy around 1918. This was the Spanish flu, although it didn't come from Spain. It was the greatest public health disaster to hit the United States, not counting the decimation of the Native American population after the arrival of Columbus. Spanish flu killed between 500,000 and 650,000 Americans in a population of about 100 million at the time. In Schenectady, 15,000 got sick, 500 died in a population of about 87,000. In contrast, with regard to COVID, about 160 have died so far. We remind you that this was during World War I, very crowded conditions, crowded army barracks, also crowded factories producing material for the war, very contagious conditions. There was no definitive cure, no vaccine. Nobody knew it was a virus. The virus is too small to be seen in a microscope. The physicians and the scientists were baffled. What's even worse, it killed young adults disproportionately, which is why you see such a dramatic drop in longevity. A child was more likely to lose his parent as opposed to his grandparent. This chart has become iconic not only for the Spanish flu, but for COVID. We compare Philadelphia experience with the St. Louis experience. In Philadelphia, the first civilian flu cases were reported on September 17th, 1918. Previous to this, hundreds of sailors were being sickened at the Philadelphia Navy Yards. Nevertheless, authorities, despite recommendations to the contrary by the public health officials, the city fathers allowed a huge citywide Liberty War Bonds parade to take place on September 28th with over 200,000 participants and onlookers. And within 72 hours of the parade, every single hospital bed in each of the 31 hospitals in the city were filled. Social distancing interventions such as school closures and bans on public gatherings were not put in place until October 3rd, by which time the local healthcare system was overwhelmed and faced catastrophe. In contrast, St. Louis, the first civilian case was reported on October 5th. By October 7th, social distancing interventions were started and the St. Louis Liberty War Bonds parade was canceled. And you can see the differences in outcome by looking at the dotted line and the solid line. This is known as flattening the curve through social distancing methods, although the term social distancing did not come on the scene until the early part of this century. There were no pharmaceutical methods available, no vaccines, no antibiotics, no antivirals. So this chart presents a good framework for understanding the response to both the Spanish flu and the COVID pandemics. It basically mimics the Philadelphia St. Louis graph. If you don't do anything, you'll get the situation on the left, the red curve, or you can take protective measures and social distancing measures of the blue curve on the right. The dotted line represents, the dotted horizontal line represents health system capacity, or you could try to raise health system capacity. During the Spanish flu, Schenectady took both protective measures and expanded its capacity, but it was still a horrific situation. October 7th, 1918, a Monday, one of the most consequential days in Schenectady public health history. Hundreds of people were getting sick, many people were dying, not just the soldiers in the army barracks in Rotterdam, but the general population. The person could go to work in the morning feeling good and be dead by the end of the day. The public health officer issued a state of emergency, closing down the schools, the churches, the theaters, all public gatherings. There was a warning that the flu was spread by sneezes and coughs. Cover your mouth with a handkerchief. Avoid crowds. If you feel sick, go home, go to bed, eat nourishing food. Many of the these methods of prevention and treatment were essentially the same as what we were heard on about COVID. But compared to COVID, we note that in 1918, there was not a complete lockdown. People still went to work at businesses and factories. People went to work at GE, even if they were sick. There were 20,000 workers at GE, 8,000 at Alco, in a city of 87,000. This was wartime. GE was working around the clock. Another thing, people were not required to wear masks. Of course, when COVID first hit, we were not required to wear masks. During the Spanish flu, the healthcare system was overwhelmed. Ellis Hospital was turning away patients. Temporary hospitals were opened up around the city. Doctors and, more importantly, nurses were overwhelmed. Many of the nurses were away in Europe in the war. Women volunteered to be nurses. Churches cooked food for families too sick to get around. The city ran out of caskets. There were not enough public health personnel to enforce isolation and quarantine. The caseload was too staggering. Hundreds of people were dying. October 7th marked the day of the closures. By October 28th, the situation began to ease. There were empty beds in the hospitals. On October 29th, the mayor of Schenectady, not the health officer, the mayor announced that schools, theaters, and public gatherings would open on November 4th, which was incidentally the day before Election Day. Not a coincidence. The health officer warned the population not to jump to conclusions that the pandemic was over. November 11th, Armistice Day, World War I ends. Spontaneous, massive indoor and outdoor celebrations in Schenectady. What happens? Spanish flu cases and deaths begin to rise again throughout the winter. By the spring, Spanish flu is mostly gone. Possible reasons, the mutation of the virus, making it less virulent. Also, a big proportion of the population may have gotten the disease and become immune to it. These are possibilities. We can ask 3 questions. Historians and scientists are trying to learn lessons for the future. Were social distancing measures started soon enough? Were the right set of social distancing measures used? Were social distancing measures kept on long enough? The research shows that those cities that did a better job on these questions had lower death rates. So we can ask these questions of Schenectady. Were social distancing measures started soon enough? And the answer is no. The Schenectady health officer regretted that he did not shut down Schenectady 3 days earlier on Friday rather than on a Monday. And given a short incubation period of 3 days, it probably would have saved some lives. Union College canceled its home football game on that Saturday with Wesleyan when it was learned that 3 students took sick back in Middletown, Connecticut. That probably saved some lives at Union. Second question, were the right set of social distancing measures used? The answer is no. Businesses and factories remained open, but this was wartime. Patriotism and the national war effort trumped public health. Restaurants and taverns and ice cream parlors remained open, but a great proportion of the young working population of Schenectady lived in rooming houses, and they depended on restaurants for their meals. No masks were required, but even Commissioner Herman Biggs of the New York State Department of Health did not recommend masks, although the city of San Francisco did mandate masks, although there was great pushback. Third question, were social distancing measures kept on long enough? The answer is no, but there was probably nothing that could have been done to stop the mass celebrations that took place with the end of the war, World War I. All in all, Schenectady had the highest death rates of capital district cities. But let us remember that Schenectady was one of the most industrialized cities in the state. Very crowded working conditions in the factories and in the rooming houses, and there was a war going on. After the Spanish flu, for many decades, Schenectady and the entire country developed a case of pandemic amnesia. Everybody wanted to forget this horrific experience. Very little history written after 1919. It wasn't until the 21st century when researchers wanted to find out what worked and what didn't work in the Spanish flu. Why? It was in preparation for the next big pandemic, which turned out to be COVID. The first case of COVID was reported in Wuhan, China on December 31st, 2019. Nobody had seen it before. It was novel. Scientists and public health officials around the world had so much to learn, so little time, so many questions that were unanswered. This is our chart flattening the COVID-19 curve in Schenectady County. Our book covers the first wave from March 20 to August 20, March 2020 to August 2020. Basically, we were in the same place we were in 1918, limited or no testing, no definitive treatment, no vaccine, great uncertainty. We basically had social, non-pharmaceutical interventions, quarantine, isolation, hand washing, social distancing. These were our preventions. The lessons from the Spanish flu are the quicker that you can start these interventions, the better. During the Spanish flu, Schenectady was on its own. In COVID, Governor Cuomo pretty much centralized decision-making into his hands so that all the counties were pretty much playing by the same set of rules and according to the same game plan. From March 1st to April 1st, New York State went from 1 case to 83,000 cases and 2,300 deaths. In terms of this chart, Schenectady County instituted both social distancing methods and it increased the capacity of its healthcare system. And I would say that Schenectady County did a good job. And by Schenectady County, I mean the county health department, Ellis Hospital, the school systems, the social service and voluntary organizations, friends and neighbors. We all took this very seriously. And one of the reasons why we took it seriously was that all eyes were on New York City, which was the epicenter of the pandemic. In New York City, the COVID images were horrifying. Cases were doubling every 3 days. Healthcare workers and first responders were getting sick and dying due to a lack of gowns and masks. Patients were dying alone in hospitals, isolated from their loved ones. Nursing homes were particularly hard hit. Refrigeration trucks were brought in to augment the hospital morgues. Mass graves were dug on Hart Island, which is the pauper burial site. In terms of death rates in New York City, the COVID and the Spanish flu epidemics were relatively similar. Emergency departments, hospital and ICU beds, mechanical ventilators were overwhelmed. And at Ellis Hospital, the doctors and nurses were worrying about this. Could this tsunami come to Schenectady? One thing Ellis did was to expand its capacity, increased its bed capacity by 50%, its ICU capacity by 100%. It canceled its elective surgery. It put restrictions on visitations. So what is it going to be? Is it going to be Philadelphia or is it going to be St. Louis? Let's look at the curves. This is the isolations on the bottom line in blue, quarantine, the top line in red for COVID-19 in Schenectady County from February 24th to August 2nd, 2020. The bottom curve in blue represents the number of people in isolation at home or in the hospital. On the bottom curve, we clearly see a surge in cases from about March 11th to a peak In the second week of April, about 375 cases. Then the curve begins to decline. What causes the decline? Most likely social distancing. And March 22nd, Governor Cuomo issues the New York on pause lockdown. Everybody stays home except for essential workers. Mask wearing was not mandated until April 15th. Quarantine, which is the red line, starts immediately on March 1st. You see a huge spike in quarantine due to a large exposure at an elementary school, which placed over 400 people under mandatory quarantine. Fortunately, no transmissions occurred. In June, the quarantine cases rose again, related to an order by Governor Cuomo requiring precautionary quarantine for travelers from high-risk states. Quarantine and isolation are the responsibility of the county health department, better known as the Schenectady County Public Health Services. Obviously, there's a huge increase in their caseload, in their workload to do case identification, contact tracing, making sure that people remain in their homes for 14 days quarantine or isolated, however long it takes. These are very labor-intensive activities. To trace the contacts of one positive case could involve making dozens of phone calls. So they certainly had to ramp up their game. This is Ellis Hospital, March 1st to August 9th. Ellis faced a huge surge, hitting its peak in the middle 2 weeks of April. Unbelievably stressful period for the staff. Went up again in late June and July, probably due to 4th of July parties. March 23rd, the first COVID death in the Capital District, which was Walt Robb. And then we saw a very rapid rise until about April 29th, when we had cumulative about 27 deaths. Then there was a gradual leveling off. We had 42 deaths as of August 7th. And as of today, we have about 160 deaths. Number of COVID hospitalizations in blue and ICU COVID-19 admissions in tan in hospitals in the capital region counties, Albany, Columbia, Greene, Saratoga, Schenectady, Rensselaer, Warren, and Washington, March 27th to August 12th, 2020. See a high of 205 hospitalizations on April 8th, with over half of these in the intensive care unit. And you'll see that the percentage in the ICU declines, probably due to a changing case mix, fewer people coming in from the nursing home, better treatments, as more is learned about the disease. So conclusions, what's apparent from the foregoing graphs is that the curves, at least for the first wave, have been flattened. Of course, at the time, we did not know what the future would bring. We did not know that there would be a rise in cases with the colder weather and people gathering inside, especially for the holidays. But looking at the data, given that virus mutation or herd immunity played no part, we must conclude that the interventions worked. We can ask some questions, the same questions that we asked for the Spanish flu. Did the curve have to rise so steeply? Were the non-pharmaceutical and other interventions started soon enough? Were the right interventions applied? Were they kept in place long enough? Was the population adhering to the restrictions? And there are many, many, many more questions that remain unanswered when the data comes in. Perhaps they will be answered. Perhaps they'll be a subject of another book we write. Let's bring you up to date. This is where we are as of June 1st, 2021. You can see that there's definitely been a second wave, which peaked around January 27th, 2021, and then we see a steep decline. No doubt the vaccine played an important part in that steep decline. And also the percentage in the ICU is still relatively low compared to the first wave. How does COVID compare with past epidemics? We have lost about 160 people. In the Spanish flu, Schenectady lost 500, many of whom were young adults. In the 1832 cholera epidemic, the number of deaths was proportionally as great, if not greater, than the Spanish flu. In the polio epidemic of 1952, very few infected children died or were paralyzed, but their parents were overwhelmed with fear. Each epidemic is viewed in its own historical context. In this context, the context of our times, COVID is an event of monumental proportions. I don't think that there's going to be a COVID amnesia. By the way, if you want to contribute your own story about COVID, you can add to the online archives of the Schenectady County Historical Society. You can contact their librarian, Marietta Carr, go to their website, and she'll tell you how you can add the story. So there is no COVID amnesia. Okay, questions, comments? Jim, do you want to make a final comment?
Yes, I do, about your own.
Can't hear you.
How about now?
Yeah.
I happen to be, by total coincidence, at the health department when we had the first case of COVID in Schenectady. I was a volunteer along with the PA, who was a volunteer. There were two of us doing some clerical work, and the first case came in. It was like electrifying. The first patient was a healthcare worker at Union College. There was a banquet, and this lady got it. And we immediately went to action. We started a phone bank, and there were two professional nurses, the PA and I. We had to call up all the other students. We had to call up the health departments in the counties that we're going to. Union College, were going to send the students home. They were going to shut things down. And then the next people we got were lists of COVID patients who went through doctors' offices, or we got lists of patients then, and then some churches. And we had to put people in quarantine, and we knew nothing. They asked, where could you buy a mask? The health department didn't know. Where can you buy the stuff to put it in your hands? We didn't know. But they brought all courses. But my wife came down to help. We worked late in the night calling these people up to go into quarantine. I just want to emphasize how good our health department is. All these patients who had to go into quarantine, some couldn't afford to miss work. They were day workers. We would send food. The health department would send food to them in their apartments. They would send thermometers. They would check on them every day to make sure they're healthy. So this is my impression of my reaction is how rapidly our health department responded to this. If anybody else has any recollections, they should record them in the Historical Society. Thank you, everybody, for their attention. More questions?
Thank you for a good talk. Looking at your flattening the curve, it definitely was a lower curve when you started having distancing and whatever, but it looked much wider. When they look at the red curve, it was a certain distance width, and it was almost double looking at the blue curve. Was that just because of herd immunity or any other reasons?
The red curve was the quarantine. The blue curve was the number of isolations due in the hospital or at home.
I think I'm looking at a different graph. The red curve was the number of cases with COVID without isolation.
No.
Can you
Let me see. I'll go back. Yeah, the red curve.
No,
the red curve is quarantine. Most of them didn't have COVID at all.
Keep going back. That's not the curve I'm talking about. That one.
Yeah.
The red is much peaker, but it's not as wide.
Right. That's right. That's right. Now you could say that maybe the number of cases were the same in the blue, under the blue curve and under the red curve, but at least the health system was not overwhelmed, and there's time to develop a vaccine. Fauci back in 2008, when we thought we were going to have an avian flu pandemic, said social distancing might give us time to develop a vaccine. So that's what that's what this. If you can't expand health system capacity, maybe you have time to develop a vaccine, or at least your doctors and nurses will have a chance to work their miracles.
Larry, you remember that back in 2008, you invited me to speak to the anesthesiologists. And at that time, we were going to have a flu hospital. And there was going to be no elective surgery. And in the flu hospital would be just respiratory problems and oxygen and IVs and the anesthesiologist. And you were one of the leaders. Everyone volunteered to staff that. Do you remember that?
I do.
Yeah. That goes to show how the volunteerism in Schenectady we can be proud of.
Marty and Jim, it's Joel Weingarten. I just like to, with this slide, just make a comment. Being a healthcare professional myself and working for St. Peter's Health Partners, I do remember that when COVID was coming out, the governor had mandated that all hospital systems needed to come up with a plan to be able to maximize or expand their capacity by 50%, in which everybody was scrambling to do so. And then he boosted that number to a full 100%, which I can probably say we weren't the only ones, but other healthcare systems, as they were doing it, were probably trying to figure out where were they going to put beds. But with the fact that having protective measures in place and flattening the curve truly allowed the facilities to do what we needed to do and take care of patients without being overwhelmed. And that dotted line that you have there, if our facilities got overwhelmed, then a lot more people were in trouble. And I know this was the situation down in New York, and they had to shuffle patients up to us in the Albany area. We weren't the only ones that got patients from New York City, so that they can be able to take care of more. So it's a great graphic.
And Joel, I would mention that Ellis, St. Peter's, and Albany Med had an arrangement to share beds if one hospital got overwhelmed. They worked as a region.
Yes, they did. And there was also plans of trying to figure out how to go about putting in a regional COVID long-term care facility to help decompress us locally as well, if it needed to get to that. But it's great when everybody can work together.
So, Marty, can I ask a question?
Yes.
So this goes back to the miasma thing. So I am surprised in some ways that that theory persisted so long, right? Because you have because you have Leeuwenhoek in, and I'm not really good with dates, I'm not a historian, right? 1600s, and you have Pasteur in the 1800s. So we knew about stuff, about living organisms that were microscopic, and we had milk pasteurization, which was huge in Europe. Was it just that the United States was so backward on bacteriology?
Old theories die a slow death. Miasma was ingrained. But the tuberculosis bacillus as a cause of tuberculosis wasn't really, that theory wasn't solidified until I think 1882. So even though they did it, they could see the microorganisms under the microscope. They didn't associate it with specific diseases until the 1880s.
Yeah. Susan, you credit the medical profession with too much intellectual thought. In 1876, Joseph Lister, who developed antiseptic surgery, who showed marked declines in operating infections, came to Philadelphia, and he spoke at a centennial meeting and told about antiseptic surgery and how all the results. And it was 20 years later before we accepted that.
Okay. Sorry, that's the scientist in me.
Yes. Remember, we're doctors. We're only half scientists.
Are there any other questions or comments for Marty and Jim? I guess not. Well, Marty, Jim, I would like to thank you both very much on behalf of Congregation of Good Arachim's Men's Club for putting the presentation together and telling us about your book. We are, as I said, greatly appreciative. And we thank you very much for your time especially on a beautiful Sunday today. On behalf of Men's Club, I will like to let you know that we will be getting you a complimentary gift. It's a Men's Club mug. I don't have one in front of me right now, but as a token of our thanks for you for this morning, and we're greatly appreciative. Thank you very much again.
Good night.
Good night. Thank you.
Thanks very much.